According to the American Cancer Society, there's a 1 in 8 chance a woman will develop breast cancer sometime in her life. And this month is Breast Cancer Awareness Month, and a great reminder to all us women to place our own health on the top of our to-do list. Here to share some valuable tips on breast health, Nurse Linda Rittenburg, Director of Specialty Care at Southwest Medical. Hi, Linda. Thanks for joining us.
You're welcome. Thank you.
I am so glad we're having this conversation. When it comes to breast health and breast cancer, it's so important that women have the facts and the current information. Share with us what you think are some very important facts about breast health.
Well, I think it's very important that women know that breast cancer is the #1 cancer that affects women. And therefore, they need to be very diligent when it comes to their breast health and do the appropriate things that need to be done to help prevent that cancer, such as screening mammogram or self-breast exam. Interestingly, most women find their breast cancer themselves.
Really?
Yes. And so it's important that a woman takes care of her breast health, does her self-breast exams, because she'll be the one that'll find that lump before a provider will find it. And notice if there's any other changes in her breasts that are suspicious, such as dimpling of her skin, or any discharge from the nipples, or if there's any pain. All of those are signs that you should see your provider.
Yes, absolutely. And now that you've said it, one of my mom's good friends detected her own breast cancer, and I remember hearing her story about it. But a woman's intuition is encouraged, especially on this topic, isn't it?
Yes.
Yes.
Yes, very.
Let's talk about the numbers. We said 1 in 8 women will develop breast cancer during their life, which is a very high number.
Yes.
What are some other things that women can do as part of their lifestyle to prevent breast cancer?
Well, it's important to know that this year 250,000 women are going to be diagnosed with breast cancer in the United States, and 40,000 of those women will die from it. And so it's important that women get that screening mammogram done, especially if they have a family history of breast cancer.
That's right. There are definitely certain things that make a woman predisposed to it, aren't they?
Correct.
And it's important to know if you have any of those conditions. So let's talk about what to look for then. What signs should women look for in their own breasts that might indicate that they need to get further attention?
So definitely a lump. You know, if you feel a lump, do your monthly breast exam. I mean, that's something simple that you can do. Look at your breasts in the mirror so that you know what your breasts look like, so that if you notice anything different, any change in size or shape, that's a warning sign to you. Any changes in the skin, any warmth, itching, any pain that's localized. You know, a lot of women will have breast pain, but it's diffuse and through both breasts. But if you have pain that it hurts you like right here, like right in a certain spot, that's something you want to talk to your provider about, because that's an important sign.
Yeah, certainly, and get it checked out. And I know that I've had a pain, and I went in and talked to my doctor about it. It turned out it was okay, but I was very nervous about it.
Right.
So there are other things that can go on. You know, when a woman gets breast cancer, it's not only, you know, very intense on a physical level, but there is a whole emotional aspect as well. And I will just say fear has got to be at the top of that list. Tell me about the emotional support that you offer for women going through breast cancer.
Sure. At Southwest Medical, we have a breast care program where women get referred either by their primary care physician, or if they've had a suspicious mammogram, we automatically enroll them in the breast care program, where they will get further diagnostic imaging. They will get a one-on-one breast exam by a certified advanced nurse practitioner. And then if the diagnosis of cancer is there, we have nurse navigators that are there to support the patient through the process. They're there to answer questions, give them that emotional support. They do one-on-one consultations with them to help them make the best decisions for their treatment going forward, and then they coordinate the care for them.
Absolutely. And Linda, I'm sorry we've run out of time, but I did want to mention too that your program has national certification, and that's worth mentioning real quick.
Yes, it does.
Yeah.
It does. We're very proud of that.
Yes, it's called the National Consortium of Breast Centers. Not only that, but at Southwest Medical, you performed over 46,000 mammograms last year in the Las Vegas area.
Yes, we
So
did.
ladies, call and book your mammograms. Yeah, keep up on it. Thank you so much.
Thank you.
Southwest Medical Associates have locations all across Southern Nevada. I'm sure you've seen their signs. Schedule a mammogram by calling the number or visiting the website right there on your screen. They are proud sponsors of the Morning Blend.